Hello everyone. In this video we are going to discuss about frontal bone. Now this is a curved thin bony plate and it is also termed as flat bone. It also lodges frontal air sinuses. So it is also classified under heading of pneumatic bone. Now when you see frontal bone, it is having a squamous part above which forms forehead, and below there are two orbital plates which are forming major part of roof of bony orbit, and in between these plates there is a U-shaped ethmoidal notch that lodges ethmoid over here. Now let's see individual parts. So first comes the squamous part of the frontal bone. Now the squamous part presents an external surface which is smooth, which forms forehead, and internal surface which lodges frontal lobes, a posterior or parietal border which articulates with the parietal bones to form coronal suture, and at the junction of this anterior surface and orbital plate you will find orbital margins. These are supraorbital margins which are sharp in their lateral 2/3 and rounded in their medial 1/3. See this. Now at the junction of this lateral 2/3 and medial 1/3, the supraorbital margin shows a notch or a foramen that is termed as supraorbital notch or supraorbital foramen. And similar name structure, supraorbital nerve and vessels are passing through it. Medial to that, the margin allows passage of supratrochlear nerve and vessels, but generally we don't find any similar notch over here or foramen over here. Now lateral end of this orbital margin forms zygomatic processes, see over here, and the tip of this process articulates with frontal process of zygomatic bone. Let me show you in articulated skull. See over here, this is supraorbital margin, this is zygomatic process, and this is frontal process of zygomatic bone, and together they are fused to form frontozygomatic suture. Okay, so this. Now behind to this zygomatic process, the posterior margin continues above as temporal line which bifurcates to form superior and inferior temporal lines, and these are found along the parietal bones. Now area below this parietal line over here, you can see this along with the adjacent area of floor of temporal fossa will provide origin to temporalis muscle and temporal fascia. Now between two supraorbital margins over here in the midline, this is the nasal part of the frontal bone and its lower margin is serrated. See this, and this is termed as nasal notch, which is connected from medial to lateral with three bones, namely nasal bone, frontal process of maxilla, and lacrimal bone. Let me show you in articulated skull. See over here, you can see this is the nasal part. Over here will be nasal notch, and this is nasal bone. This is frontal process of maxilla. You can see the suture, and behind to that will be lacrimal bone. So three bones from medial to lateral, right from midline. Over here you can see again, and these two nasal bones are connected by internasal suture, and the nasal bones are connected with frontal bone by frontonasal suture. So the meeting point of frontonasal suture and internasal suture is termed as nasion. Now when you see the frontal bone separately, behind this nasal notch along its posterior part you can see a triangular nasal spine. Say this. Okay, now this nasal spine in front is connected with posterior sharp margin of nasal bones. So when we join separate nasal bones together, let me show you. These are nasal bones, and along their medial border, when we join them together like this, so their posterior sharp margin, say this, over here in the midline, will be connected with this anterior border of nasal spine like this, and together this will help in formation of part of nasal septum. Okay, now below to that, below to the nasal spine over here lies the perpendicular plate of ethmoid. Let me show ethmoid. See, this is ethmoid, and if we see from in front and below, you will find this perpendicular plate, and this part of perpendicular plate is connected with the lower border of this nasal spine. Okay, like this, and together they form part of nasal septum. See this. Now on either side of this nasal spine is grooved. See this, I'll bring it closer. See over here. Now this grooved area on either side of nasal spine will form uppermost part of nasal cavity, roof of nasal cavity we can say. Okay. Now about to this orbital margin, over here you can see the external surface shows two elevated arches. These are termed as superciliary arches or supraorbital arches, and the imaginary meeting point of these two is termed as glabella. See over here, this is more pronounced in case of male skull due to underlying frontal hair sinus. Let me show you an articulated skull. See this, over here you can clearly make out this superciliary arches, and the meeting point will be glabella. Above to the superciliary arches, external surface shows two another elevations. These are termed as frontal tuber, and deep to it lies frontal poles of the brain. Now frontal tuber are more demarcated in case of children and in females, and these are the sites of commencement of ossification for the frontal bone. The entire external surface is smooth and it is covered by frontalis muscle on either side, and in between there lies epicranial aponeurosis. So this is regarding external surface. Now let's see internal surface. It is irregular, it is having multiple pits, and these are produced by gyri of frontal lobe. There are certain vascular markings, see this, and these are produced by the meningeal vessels. Now in the midline you will find a frontal crest, sharp frontal crest, and that will bifurcate, and that commences the sagittal sulcus, which lodges anteriormost part of superior sagittal sinus, and margin of it provides attachment to the FALX cerebri. Now below to that there is a notch. Below to this frontal crest there is a notch, and this notch comes in contact with corresponding notch of ala of crista galli. Together they form foramen cecum. Let me show you in separate ethmoid bone. This is the crista galli and these two are ala. So in the midline you can see there is a notch. See this. Now this notch will come in contact with the notch of the frontal bone, and together they form foramen cecum. Let me show you an articulated skull. See over here. So we are discussing this foramen. Okay, this is frontal crest, and here comes a notch, and behind these are ala of the crista galli. So together they form this foramen cecum. Generally no significant structure passes through it, but sometimes it allows passage of hamsteri veins that will communicate the superior sagittal sinus above and below to the veins of nasal mucosa. Now most posteriorly, the squamous part of the frontal bone shows a serrated border. This is parietal border or posterior border, and this articulates with corresponding frontal border of parietal bone, and together they form coronal suture. See over here, these two are parietal bones. They are connected by sagittal suture, and this is the serrated frontal border or anterior border of parietal bone. So when we join these two together, you can see they will form coronal suture. See this. This is how the articulation will take place. Now below to that, this posterior border or parietal border shows a rough triangular part. See this. And this is connected with greater wing of sphenoid. Let me show you. So this is sphenoid and these are greater wings, and over here you can see there is a corresponding rough triangular area. So these will articulate like this. Like this. Okay, so this is regarding squamous part of the frontal bone. Now next is orbital part. It is seen in the form of two orbital plates. Now each plate is a curved plate which extends posteriorly beyond orbital margin. It is triangular in shape. It is having two surfaces, orbital and cerebral, and three margins, medial, posterior and lateral margin. Now let's see first orbital surface. Now orbital surfaces are depressed smooth surfaces and they are forming major part of roof of bony orbit. See over here you can correlate it with the articulated skull. So these are the orbital surfaces, and posteriorly the roof is completed by lesser wing of sphenoid. Now anterolaterally each surface shows depression. Over here you can see, and this is termed as lacrimal fossa, which lodges orbital part of lacrimal gland. Anteromedially there is another depression or spine which provides attachment to fibrocartilaginous pulley through which there traverses tendon of superior oblique muscle of eyeball, and this will acutely change its direction. The cerebral surface, it is elevated, it is pitted because of the gyri of frontal lobe, and it forms major part of floor of anterior cranial fossa. The posterior margin is articulated with lesser wing of sphenoid. Let me show you in articulated skull. See over here. So this is cerebral surface. As I mentioned, it forms major part of floor of anterior cranial fossa, and over here lies the orbital surface of frontal lobes. Now posteriorly, the posterior margin is connected with lesser wing of sphenoid. These are lesser wings, and these together will complete the anterior cranial fossa. The medial margin is connected with the ethmoid. Let me show you in separate bone. See this. These medial margins collectively form a U-shaped ethmoidal notch, and over here lies the labyrinth of ethmoid. See over here. This is ethmoid. This is its superior surface, and this is crista galli. On either side of it is the cribriform plate of ethmoid, and these two are labyrinth. So this ethmoidal notch is related to superior surface of labyrinth of ethmoid like this. And this is how the articulation will take place. The medial margin is thick, and through which you can see frontal air sinuses. See over here on either side. So same thing you can see in articulated skull. This is crista galli, and on either side of it is cribriform plate of ethmoid, which is perforated and which allows passage of olfactory nerves. So this cribriform plate of ethmoid and crista galli will fill the ethmoidal notch. And as I have discussed, the margins or medial margins of orbital plate are related to superior surface of labyrinth of ethmoid. Now their articulation shows two canals which are visualized from medial wall of the orbit. See over here, these are in the form of anterior and posterior ethmoidal canals, and this will allow passage of anterior and posterior ethmoidal nerve and vessels respectively. See, this is the same thing. Over here you can see anterior and posterior ethmoidal canals, and these are found at the junction of medial margin of orbital plate and labyrinth of ethmoid. So this is regarding thick medial margin. Now remaining is lateral margin. It forms anterior boundary of this rough triangular area which is connected with greater wing of sphenoid that we have discussed. Okay, so this is regarding frontal bone. Hope you have understood well. Thanks for watching.